Okay, then I'll take your first aid theory class. Okay, we were discussing about accident, right? So, accident, is it over? Is it over, accident? Have we finished? Say fast, whoever were present in the class. Accident, did we finish? Traffic accident, water accident?
Yes, ma'am, till
Yes,
water accident.
I think it's over. Is it over? Say fast.
Yes, ma'am.
Okay. Okay, then you write down another unit. Okay, unit 7, you write common medical emergencies. Write down medical emergencies. Okay, write down medical emergencies. Okay, common medical emergencies, unit 7. And the first topic that we will discuss it about is about asphyxia. Are you able to see the screen?
Yes, ma'am.
Okay, so asphyxia is abnormal breathing. In short and simple, it is known as abnormal breathing. Okay, when there is insufficient supply of oxygen to the body, it is known as asphyxia. Okay, an example of asphyxia is choking. You know what is choking? I already told you what's choking. Okay, what is choking? Anyone? What is choking? Do you know or not? Hmm?
Ma'am, I don't know.
Others? Choking? Sriyam, what is choking? Sachi, what is choking?
Difficulty breathing.
What? Difficulty in breathing or inability to breathe,
Breathing.
right? So, asphyxia generally causes choking. Okay, and it is also generalized by hypoxia, which affects primarily the tissues and organs. Okay, so asphyxia, you write till here. And this asphyxia can also ultimately lead to coma and also death of the person. Okay, in short, asphyxia means insufficient supply of oxygen to the body or abnormal breathing. In short, okay, the person will not be able to breathe in properly. Okay, that is known as asphyxia, means inability to breathe. Okay, whenever there is insufficient supply of oxygen to the body, to the tissues and organs, what happens? The person suffers from asphyxia. Okay, so right till here. You take the pictures, otherwise just take the picture and you can write it down later. Just take the picture, take the screenshot. And then you write down the causes. What are the causes of aphasia? Click the picture, take the picture. So these are some of the causes of aphasia, like drug overdose, drowning, okay, respiratory distress, okay, means inability to breathe properly. There will be the respiratory distress in the upper respiratory tract and the lower respiratory tract, okay. Then there will be sleep apnea, respiratory diseases will be there, strangling will be there, okay. Then there will be muscle spasm, okay, muscle spasm will be there. So these are some of the causes of aphasia, okay. Next you just um take the picture of sign and symptoms of aphasia. What will be the sign and symptoms of aphasia? The first will be difficulty in breathing or inability to breathe,
Or
okay,
to breathe.
a bluish
Okay,
tint,
the bluish tint.
okay. Then there will be irregular heart rate. The pulse rate will not be constant, okay. It will be more than the normal, or else it can go less than the normal heartbeat sound, okay, or the pulse rate. Then there will be weakness and seizures. Then there will be, if long term result of aphasia, if the aphasia continues for long term, okay, then it might ultimately lead to death of the person or else coma of the patient. So these are some of the symptoms, sign and symptoms of aphasia. Take the picture, take the screenshot. Okay, so this was in short about aphasia. Okay, all this actually it is a very long topic. It's a large topic. Okay, all these topics are very large, but the thing is that I'm just giving you in short. Just you just need to know what is aphasia. You just need to know some of the causes. What are the common causes of aphasia? And lastly, the sign and symptoms. What will be the sign and symptoms of a person suffering from aphasia? So these three things are enough for you to know. So next we can discuss about, next you write down unconscious patient. Are you able to see the screen?
No, ma'am. No, ma'am.
Wait. Did you understand aphasia? Did you understand or not? Say fast. Did you understand aphasia?
Yes, ma'am.
Are you able to see the screen?
Yes, ma'am.
So next we will discuss about unconscious patient. Okay, so unconsciousness. The topic is after aphasia. The next topic is about unconscious patient or unconsciousness. Okay, so in this you already know what is unconscious, what is a conscious person, and how does an unconscious patient looks like. You already know the difference. Okay, so unconscious is a state in which the casualty becomes insensible to commands because of an interruption to the normal functioning of the brain. Because of the abnormal functioning of brain, what happens, the person is not able to take in the commands like if you ask, for example, here, what is your name, the person won't be able to answer you back. If you say where do you live, the person won't be able to know where he is living because he's unconscious. He won't be able to respond to the commands that you are giving. Okay, how old are you, whatever you ask, okay, the person won't be asking, will not be replying back to you. Why? Because the patient is not conscious, but he is an unconscious patient. Most probably he is in coma. Okay, if long term, then it will be coma. Right, you can take pictures, take the screenshot. Have you taken the screenshot?
Yes, ma'am.
Take this. When the person becomes conscious again after a period of unconsciousness, means when a person regains his consciousness back, what happens? He might suffer from confusion. He might be confused where he or she is, what happened, what incident happened, what accident had happened, how he became unconscious. Okay, he might be confused. He might be in a confused state of mind when he becomes to his consciousness, or he might feel drowsy. Okay, lightheadedness means there will be a slight headache, then headache, then there will be loss of bowel and bladder control. Bowel and bladder means urine and stool. Okay, bowel is known as your stool and bladder is known as your urine. Okay, so there will be for a certain period of time when the person gains back his consciousness, the person might suffer from bowel and bladder control, or you can say incontinence. Okay, then fits will be there and there will be difficulty in speaking because the person had been unconscious for so long time that he might have a bit difficulty in speaking, but he will regain his strength and everything back. But after all these are for short period of time. Okay, and if it continues for longer period of time, then he will have to go for further medication. Okay, just take the picture. Take the picture. And then what are the causes of unconsciousness? Okay, head injury. Okay, most probably the cause of unconsciousness of a patient is maybe because of head injury. Okay, then there might be a disturbance of the blood supply to brain. Okay, because of shock or stroke. Then there might be disturbance in chemical composition of blood because of why? Because of the lack of oxygen, as in asphyxia. Okay, and you already know what is asphyxia. And lastly, because of the disturbances in the electrical activity of the brain. Okay, whenever there is a there are electric impulses present in our brain. So when that electric impulses are not able to circulate properly in the brain, what happens? The person might become, or the person might suffer from unconsciousness. Okay, example is epilepsy. Just take the picture. Next, what to do means what will you do when a person is suffering, from unconsciousness? What will you do? First, you will have to see for his safety, then you will have to call for help. Second is you have to provide first aid. Okay, then you should talk loudly to the casualty, tap him. Then if casualty, check if the casualty is conscious or unconscious, and then you should act accordingly. Next, to do so, first you will have to talk loudly. If you talk in a very soft tone, the person is already unconscious. He or she will not be able to listen to you properly. So your voice should be a bit loud and sharp. Okay, and then you will have to shake the person. When you shake the person, at that time also you can know whether the patient or the casualty is conscious or unconscious. Then, if by chance, if you see that the person is slowly opening his eyes, then what will you do? You will have to ask him few questions. That is, what is your name? Okay, then where do you live? How old are you? You will have to ask these simple questions to the casualty. Okay, then check if the injured person responds to simple commands. Squeeze my hand, move your arm or leg or foot or hand. You will have to ask him to do all of these things. If there is no response, then what will you do? You will have to pinch the person. Okay, pinch him a bit hard, not softly. Into a command, it should be a bit hard, and then you will have to check if he or she opens his eyes or not. Okay, so these are the simple things that you can do. Okay, when you encounter an unconscious casualty. Okay, just take the picture. Have you taken the picture?
Yes,
Yes
ma'am.
or okay. What do I do when the casualty responds? If the casualty is responding to do, what will you do? You won't just leave the casualty there and you will go back home, right? You will have to do something. So what will you do? Try not to change the position. Okay, in whatever position he or she might be lying down, don't ask him to move at that time. Okay, then you have to try to find out what happened to the person. Okay, you will have to ask him and you will have to know what has happened to the person. Is it because of any accident? Did he fell down? Or because he was feeling fainting? Anything. The reason can be anything. So you will have to ask the casualty. Next, you will have to tell the person to stay calm. Okay, calm, and he or she should not move. Okay, he should be steady. Then look and feel for breathing. You will have to check for his respiratory rate. Then keep checking the casualty. You will have to check the casualty so as to make sure that the situation is not worsened. Okay, if the casualty is feeling a bit better, you can provide him with some, you can give him water to drink. Okay, if you have some snacks, you can share it with him. But if the situation is not good, if the person is not feeling good at all, okay, then you will have to call for medical aid. Then verify. You will have to see the level of consciousness of the patient and also the respiratory rate, that is the breathing rate. Lastly, find medical help for the person if required. Okay, these are the things that you will do if the casualty responds to your command. Okay, take the picture. Next, what do I do when the casualty does not respond? Okay, what will you do if the person is not responding? What will you do? So these are some of the steps that you should do. Okay, just take the picture. Have you taken the picture?
Yes, ma'am.
Next, write down, what do I do when the person stops breathing? If the person stops breathing, what will you do? The most important thing is your CPR. Okay, cardiopulmonary resuscitation. This technique you will have to follow. If the person stops breathing, then you will have to start waking up the victim. Okay, you will have to move the patient. Then you will have to try to open his eyes and breathe normally. Okay, then next is you will have to help. Okay, until the help arrives, you will have to continue with your CPR. Then you become too exhausted to continue. If you become too exhausted to continue, then you will have to give to the other partner. If someone is there nearby you, you will have to ask the person to help you. Because this CPR, whenever you provide CPR to the patient, CPR is not an easy thing. Okay, you become very much exhausted. It's very much tough to do. Okay, the scene becomes unsafe for you to continue. What do I do when a person stops breathing? These are some of the things. You should not interrupt the resuscitation until these things happens. Okay, so you should know this. Take the picture. Have you taken?
Yes, ma'am.
Okay, so this is all about your unconsciousness. Okay, take the pictures, but do note it down in your notebook. Okay, don't just keep it on your mobile phones. Resuscitation, drowning. Drowning, did we complete? Next, you write, next is your drowning. In unit 7, okay, in unit 7, medical emergencies, there are 4 chapters to be covered. That is unconsciousness, then your asphyxia, next is your drowning. So this is drowning. So drowning can result in death. Okay, drowning can result to death of the person. So from hypothermia means whenever the temperature goes down to normal. Okay, if it is hyperthermia, that means it is fever.
Ma'am,
You can say pyrexia. Yes.
ma'am, I can't see the screen.
Okay, okay. Is it visible now?
Yes, ma'am.
Okay, so drowning. Okay, drowning ultimately results in death of the person from hypothermia. Hypothermia means temperature below the normal, and you already know the normal temperature. Okay, so whenever it goes down, it is known as hypothermia, and it mainly happens because of immersion in cold water. Then there might be sudden cardiac arrest. Okay, your heartbeat might stop beating. Okay, why your heartbeat will stop beating? Because of the cold water, and because of spasm of the throat blocking the airway. Whenever you get drowned, okay, whenever a person get drowned, what happen? Excessive water enters through the nose and mouth. Okay, so because of that, there used to be spasm in the throat, and it also leads to blockage of the airway. Okay, because of excessive intake of water through your nose and mouth. So because of that, the person suffers from hypothermia. Okay, and the person will feel very cold, very chilled. Okay, then a casualty rescued from a drowning incident should always receive medical attention. Okay, then you just write till here. You can write the whole thing. For drowning, just take the whole thing. Then for your aims, what will you do? If you see a person drowning, what will you do? The first step is you will have to restore his breathing. How will you restore the breathing? By CPR technique, mouth to mouth ventilation, or any kind of resuscitation techniques that should be followed properly at that time. Then you will have to keep the casualty warm, because the person is suffering from hypothermia. Because of that, you will have to make him feel warm. Okay, if he will feel too cold, then he might go to coma, and ultimately it might lead to death of the person. Next, lastly, you will have to arrange for urgent removal to the hospital. So this is your aim. Okay, what you should do when you get a person drowned. Okay, take the picture. Next, what to do? What will you do? What will you do when you meet when you get a person who gets drowned? What is your first thing that you should do? Except the aims, what to do? There are 5 things that you can do for the person. So you will have to check for his vital signs. Okay, you will have to check his level of response. Level of response means you will have to shake the person, shake the casualty, ask his name. Okay, see for his breathing, see for his respiratory rate, pulse rate. Okay, until help arrives, you will have to monitor and also check the vital signs of the victim. Then you will have to start the CPR technique. Okay, then you will have to replace his wet clothes. As the person is drowned, his whole body, his whole clothes will get wet, so you will have to take it off and try to give him some warm clothes to put on. Okay, if at that time, if there is nothing, if you have something extra with you, then you can even share your clothes with the victim so as to make him feel warm. Okay, so these are some of the things that you can do. If you read, you will just come to know these are simple things. Next is your stages of drowning. There are 5 stages of drowning. That is surprise. In this stage, the victim recognizes danger and becomes afraid. Okay, next is involuntary breath holding. The person is not able to breathe. Next is unconsciousness. The person might become unconscious. Then next is your hypoxic convulsions. Okay, next is lastly is your is death of the person. Okay, unconscious, then hypoxic convulsion, clinical death. So these are the 5 stages of drowning. Okay, whenever there is an absence of oxygen, okay, in the body, then the person might suffer from hypoxic convulsion. So these are the 5 stages of drowning. Take the picture. Have you taken the picture? Have you taken a screenshot or not?
Yes, ma'am.
Okay. So, and the last one is your resuscitation techniques. Okay, in common medical emergencies, there are 5 things to study. That is your asphyxia, then unconsciousness, drowning, and resuscitation technique. Resuscitation technique, I won't give you notes anymore because we have already discussed in our practicals. Okay, and you can study the same thing for your theory. No need to add some more things there. Okay, you can study from your practical itself. So, okay. So I will discuss till here for today. Okay, the medical emergencies. If you have any doubt, you can ask me. But these are simple things. If you read, you will just come to know. Okay. Okay then. Thank you. You all can give your attendance. Okay, you can leave the meeting. Thank you.
Thank you, ma'am.